The benefits of the influenza vaccine are, I guess you could look at it in two senses. There's the general benefit to the community and there's the specific benefit to the individual. From a community point of view, we have certain members of our community who are much more susceptible to severe disease. And if we can control the amount of disease in the population, we can protect those vulnerable individuals. So in that way, everyone being vaccinated helps to protect the more vulnerable members of our community.
In 2017, we had a really bad flu year in New South Wales. There were in fact about 650 deaths from influenza across the state. We had a much better year in 2018. We only saw about 40 deaths across the state. We really think that the reason we had a much better year in 2018 was the high levels of vaccination in our local population. There was a widespread awareness campaign. Flu vaccinations were provided free to high-risk groups, and we think that had a really good effect on the numbers of people presenting with influenza.
The best time to have the flu vaccination has changed a little bit in recent times. People are used to having the flu vaccine in early autumn, around March. But we think that the maximum benefit of the flu vaccine probably only lasts 3 to 4 months. So we're now recommending that people delay a little bit to around April for having their influenza vaccine each year.
I get my flu shot every year in April to prevent getting all the symptoms and, potentially missing out on work from all the sickness that I'd be experiencing. So I think it's a good thing to do just to completely shut it down before you have any potential of actually getting the flu.
In 2015, South Australia and Western Australia started doing flu vaccinations in pharmacies for their patients. And in 2016, the other states began to follow, including New South Wales. I believe it was introduced so that patients could get better access to flu vaccines. Pharmacies are open longer hours, pharmacies are more readily accessible by most people, and it's quite affordable for people to be able to access it and protect themselves and their potentially more vulnerable family members against the flu.
In our community, there are a number of groups at high risk of catching influenza. We think of particularly the very young, so children under 5 years, and the elderly, so adults over 65 years. But also patients who have chronic disease are at quite high risk of influenza, so people with chronic liver disease, chronic kidney disease, chronic lung disease or chronic cardiac disease. People with cancer or immune conditions are at quite high risk. People might find it surprising that pregnant women are at very high risk of influenza and are particularly at high risk of complications from influenza, so it's especially important that they seek immunisation early.
So not every pharmacist can provide a flu vaccination. They actually need to go through an accredited course before they can do that. This course is to ensure that vaccines are stored appropriately, administered appropriately, and patients can be monitored closely after they're vaccinated to make sure that there's no small chance of a side effect that may occur. You'll know that your pharmacist is accredited to provide the flu vaccine by an accreditation certificate that you should see in the consultation room where you get your flu vaccination.
I have had the flu before and I experienced fevers, high temperatures, feverish chills, a lot of coughing, dizziness, and it lasted for about 10 days, almost 2 weeks. I know for myself, missing out on work is extremely stressful and in turn can affect your mental health, and it can be quite awful.
When the flu season hits, it's really important that we have good flu hygiene, and that means washing your hands regularly, and if you need to cough, please cough into the crook of your elbow, not into the air around you.
So if you do happen to get the flu, the best things that you can do are provide yourself some supportive measures. So simple things like paracetamol or ibuprofen, they'll keep the fever down and keep the pain away. If you have certain symptoms like a runny nose or a cough, you can use cold and flu tablets. Most importantly, make sure to wash your hands, use a hand sanitizer. Those things can help prevent the spread of the disease to your friends and family. Don't go to school, don't go to work or university at that time as well, because we don't want to spread the flu around to other people.
The EDs get very busy in winter and you find that people are crowded close together, and the last thing we want is for people to be infecting each other in the ED environment. If you're coping okay at home, there's no need for specialised testing. You can go and see your GP or you can call the Health Direct line for advice. Of course, if you're really worried, so for example you're having chest pains or difficulty breathing or you're confused, of course you should come to emergency and we're here to help if you need us.
The vaccine is available free of charge to a number of groups in our community. In particular, people aged 65 and over are entitled to a flu vaccine every year. In addition to that, we have other groups such as children 5 and under who are entitled to a free vaccine. Pregnant women who are also at risk from influenza are entitled to a free vaccine, and Aboriginal or Torres Strait Islander patients are entitled to a free vaccine.
Influenza can be a very serious illness, so it's very different to the common cold. And that's something we get asked all the time, which is this flu or is it a cold? Part of the difference with flu is it comes with a high fever, it comes with aches and pains, and it can come with complications such as pneumonia, confusion, other things. Influenza in the high-risk groups can be a very serious illness. We've had deaths from influenza, we've seen people critically requiring ICU from influenza. So influenza can be a very serious illness, but we have a great tool to prevent it in immunisation, and it's important that we make sure people are offered that.